Okay, perfect. So thank you everyone for joining us today. So September is National Sickle Cell Awareness Month, so we wanted to host this webinar in recognition of sickle cell disease. So today we'll talk about the nutrition concerns in sickle cell disease and the impact that God's Love We Deliver has on individuals diagnosed with sickle cell disease. And for those of you who don't know, as an organization, we actually started accepting sickle cell disease as a primary diagnosis late March of this year. So we're coming up on about 6 months of serving those with sickle cell disease, and we'll talk a little bit more about that later. Okay, so we'll start with an overview of sickle cell disease, and we'll call it SCD for short. So SCD is a lifelong genetic red blood cell disorder characterized by chronic hemolysis and vaso-occlusion. Sickle cell disease primarily impacts those with ancestors from sub-Saharan Africa, regions in the Western Hemisphere like South America, the Caribbean, and Central America, and then places like Saudi Arabia, India, and Mediterranean countries like Turkey, Greece, and Italy. So SCD occurs in 1 of every 500 Black or African American births and 1 of every 16,300 Hispanic American births. For acute complications, individuals commonly experience pain, fever, bacterial infections, chest pain, shortness of breath, fatigue, tachycardia, jaundice, urinary symptoms, and more. And they also experience chronic complications like delayed growth in children, retinopathy, chronic lung and kidney disease, and then risk of stroke and cardiac failure. The most common clinical manifestations you'll see are the chronic anemia and the recurrent acute pain episodes, often seen in individuals diagnosed with SCD. And then on the right, we just have a graphic of red blood cells normally. So you'll see the disc shape of red blood cells, and then you'll see the sickle cell red blood cells seen in individuals with sickle cell disease. So some common nutrition-related issues in sickle cell disease are having higher nutrient needs, having a reduced appetite, having nutrient deficiencies, chronic dehydration, having growth delays in children, and then medication side effects. So we'll talk about each of these in a little bit more depth. So first we have higher nutrient needs. So those with sickle cell disease often have higher nutrient needs than individuals without a diagnosis. And this is from a bunch of different reasons, but one of the main ones is having chronic anemia and the increase in red blood cell turnover. So individuals are constantly needing to regenerate the red blood cell supply, which requires a lot of energy. And individuals also have increased inflammatory and oxidative processes, which can increase resting energy expenditure. You also see an increased rate of protein turnover, again, from the need to constantly regenerate red blood cells. So all of these things and all of these, the pathophysiology that happens lead to a higher demand for calories, protein, and then nutrients like iron, folate, vitamin B12, zinc, vitamin C, and vitamin E. So the nutrition recommendations for higher nutrient needs would be to encourage frequent energy-dense meals to make sure that individuals are getting enough calories, protein, and nutrients. You can also consider adding oral nutrition supplements, something like Ensure or Pediasure or Boost, to help increase energy intake. And then next we have reduced appetite. So pain crises often result in a reduced appetite, which can further worsen undernutrition status in those with sickle cell disease. So even in times without a sickle cell pain crisis, the average intake of those with sickle cell disease can be lower than recommended intakes. So you have both the higher nutrient needs and the reduced appetite, which makes undernutrition really easy. So again, nutrition recommendations would be to encourage frequent energy-dense meals to make sure that individuals are getting enough calories, protein, and nutrients. And again, considering an oral nutrition supplement, if needed, can be really helpful to make sure that calorie, protein, and nutrient intake is high enough. And then again, because we know that individuals with sickle cell disease have higher nutrient needs and also have periods of reduced appetite, we also see that nutrient deficiencies are really common. So some common deficiencies we see are zinc, selenium, B vitamins, folic acid, iron, vitamins A, C, E, and D, and then omega-3s. So supplementation can be really important, especially if somebody is unable to eat frequent, regular meals, or if we know their intake might not be enough. It's important to talk about supplementation, decided in collaboration with the medical team, of course, and then also checking for lab work when able to determine if any supplements are necessary. Another really common nutrition-related issue is dehydration. So again, because of that reduced appetite and intake, dehydration can be pretty common amongst those with sickle cell disease. Additionally, proper hydration is super important for preventing vaso-occlusive events and pain crises. So the nutrition recommendation is to aim for at least 8 to 10 glasses of water each day, and that could be more or less depending on what an individual's doctor recommends. But again, hydration is super important. So drinking throughout the day, drinking water, it might be the oral nutrition supplements, but making sure that the individual is getting enough hydration. Number 5, so delayed growth and development in children and adolescents is another really big issue, again, related to the reduced appetite, coupled with the higher energy needs related to sickle cell disease, but also just in general to children and adolescents. So it's really important to pay special attention to calorie, protein, and then vitamin and mineral intake in children, because children are at risk for stunting, wasting, and disease-related malnutrition. Adolescents may also experience delayed puberty, and nutrient deficiencies can also play a role in the delayed growth and development. So the nutrition recommendation here would be to pay extra attention to energy and nutrient intake in the pediatric population, and again, consider oral nutrition supplements or fortified foods when appropriate. Oops. And lastly, we have side effects of medication. So some common medications for sickle cell disease treatment include hydroxyurea, iron chelation therapy, and then analgesics. And all of these can impact nutrition status either directly or indirectly. So hydroxyurea may decrease appetite and impact nutrient absorption. And then iron chelation therapy may cause gastrointestinal side effects, mainly stomach upset and diarrhea. And lastly, analgesics can have several gastrointestinal side effects that might impact appetite and oral intake, such as constipation, diarrhea, nausea, vomiting, and reflux. So it's really important, again, to recommend eating regular meals, energy-dense snacks, and then adding nutrition supplements if needed. To prevent constipation, we can also talk about increasing whole grains, so getting more fiber in, again, getting enough fluid, but also incorporating physical activity as able to. All 3 of those things can help prevent constipation. And it's important before we talk about our services just to look at how nutrition care impacts sickle cell disease in general. So we see a lot of different factors that go into health and well-being outcomes for individuals diagnosed with sickle cell disease. So a big one is when individuals are admitted to the hospital, there are really low referral rates to seeing registered dietitian nutritionists in healthcare facilities. And a lot of that is because nutrition really isn't a part of standard clinical management, and it's often overlooked as a key aspect of medical care, at least related to sickle cell disease. And again, this is somewhat because we don't have readily available access to reputable nutrition resources and clinicians, and we don't really have widely established nutrition guidelines for sickle cell disease. So all of these things impact the health and well-being outcomes for those diagnosed with sickle cell disease, which is why access to proper nutrition and nutrition education is really important. And that brings us to our services and how we can help individuals diagnosed with sickle cell disease. So for everybody who doesn't know, we'll just start with a brief history of God's Love We Deliver. So we started as a direct response to the HIV/AIDS epidemic in the 1980s, and we've grown significantly since that time, and now serve individuals with almost 400 diagnoses in order to help prepare and deliver nutritious, high-quality meals with the goal of alleviating hunger and malnutrition. It's extremely important that all of our clients receive our meals free of charge. So all meals are free and delivered to our clients without regard to income, documentation status, or citizenship. And we do know that the word God is in our name, but we are a non-sectarian organization and we serve individuals of all religious backgrounds. And then just to briefly talk about what we do, so we are the leading provider of delivering life-sustaining meals and nutrition counseling for people living with severe and chronic illness in the New York metro area. Our goals are to alleviate hunger and malnutrition, and we do this by problem solving for individuals unable to shop or cook meals for themselves. And we provide illness-specific nutrition education and counseling to clients, and all of our meals are hand-tailored by our team of registered dietitian nutritionists and then delivered to our clients' doorsteps. So our philanthropic program serves individuals in all 5 boroughs and then Hudson County, New Jersey. We'll talk a little bit more specifically about delivery logistics later on. But first, it's important to talk about what makes our meal special and what is the medically tailored meal intervention. Okay. So what are medically tailored meals? So medically tailored meals are an evidence-based intervention designed for individuals living with severe or chronic illness. And this intervention really has 2 key aspects. The first being that all of our meals are designed by a team of registered dietitian nutritionists. So the meals are specifically tailored to a client's medical history, allergies, excuse me, preferences, and medications. And at baseline, all of our meals are low sodium and heart healthy, and then refined further from there, depending on the specific client's needs. We also provide ongoing counseling and education from our team of registered dietitian nutritionists and are able to provide nutrition education materials in different languages for several different health conditions. So for us, it's really important that individuals receive both the medically tailored meal plus the access to our team of registered dietitian nutritionists for that really important ongoing education and counseling. As far as meal modifications go, this is how we tailor our meals specifically for our clients. So for individuals with heart disease, we can offer high fiber, low fat, and low sodium meals. For individuals with congestive heart failure or on dialysis, we have low fluid meals. For individuals with diabetes, we offer low sugar meals. And then for anybody with gastrointestinal concerns, we offer mild GI meals. So meals with lower acid and spice levels. We can also accommodate for preferences. So we have vegetarian, pescatarian meals, and then we can omit any protein. So no beef, no pork, no chicken, and/or no fish. We also can accommodate for allergens and restrictions. So we can accommodate for no dairy, no shellfish, and no nuts. And then we have our children's wellness menu. So we're able to provide specific meals for children. And we also have texture modifications. So if anybody has difficulty chewing or swallowing, we're able to provide those softer meals to help them be able to tolerate those meals as best as possible. For our meal service, so meals are available for 7 days a week. And again, they're tailored specifically to the individual client's needs. Meals are cooked in our kitchen in Soho and then blast chilled and sealed and delivered to the client. They contain no artificial preservatives, additives, starters, or fillers, and the meals are microwave and oven safe, so clients can simply heat them up according to the directions on the package when they receive them. Some breakfasts that we'll typically deliver, we have cooked options, cold options, and then milk. For lunch, we have super salad plus a whole wheat roll and dessert. And then dinner will usually consist of an entree that has a lean protein, vegetables, and then a source of carbohydrates. And delivery will depend on the patient's zip code, so it happens 1 to 2 days per week, and it'll depend on where the client lives and also on their storage capacity. So if an individual has larger refrigerator or freezer space, they might have just one delivery per week. But if an individual has smaller refrigerator space, they might get delivered 2 times each week. And each delivery will consist of multiple days of meals. For our intervention, it really starts with referral. So anybody can refer a client to us. Sometimes it's medical personnel, health plans, it could be a neighbor or a family member, but it all starts at that referral. As soon as the client is deemed as eligible, our nutrition team will conduct that intake assessment and decide what that client's specific meals will look like. So they'll do a comprehensive history, medical history, get the patient's allergens, their specific food preferences, and then they'll design the meal for that client. The meals are then cooked from scratch in our kitchen in Soho, which you can see on the right of this screen, and then delivered straight to the client's doorstep for enjoyment. And hopefully the client feels more supported in managing their chronic illness because now they have specifically tailored meals and the option of ongoing education and counseling. And it's important to talk about why specifically medically tailored meals are so beneficial for those with sickle cell disease. So medically tailored meals can help individuals diagnosed with sickle cell disease eat more regular meals that are filled with necessary nutrients, which help tackle both the issues of undernutrition and nutrient deficiencies. So the meals are ready to heat, which means they're super easy to heat up and eat, and our pre-made meals help clients eat regularly timed meals every day. Our meals are also nutrient dense, so they contain a wide variety of foods, which increase intake of various vitamins and minerals. And we know that nutrient deficiencies are quite common, so it's really important to make sure that our clients get a wide range of nutrients. We also have fiber-filled meals, so meals have several plant-based components, which helps our clients get enough fiber each day and hopefully prevent constipation from some of those medication side effects. And lastly, our meals provide a way to maintain routine in daily life. So having pre-made meals can help create a daily routine. It can also serve as a good reminder to drink water and stay hydrated and take any prescribed medications. And here we just have a few pictures of our meals. So we know that appetite is more than just eating. It starts with what our food looks like. So it's really important for us to have colorful, fresh meals. And we know that New York City is an extremely diverse place. So it's important that we offer culturally relevant meals and try to make sure that each culture feels represented in the meals that they're receiving. And we always take annual survey feedback into account when deciding which meals to bring in for the next menu cycle as well. In addition to our clients receiving our meals, we also offer a children's program and an at-home caregiver program. So dependents under age 19 and caregivers are eligible for our meals. And we know that specifically with sickle cell disease, there is a genetic component to the disease. So it's a lot of times there are multiple people in a household who can receive our meals and who are eligible for our meals. So it's really important that we serve everybody because we know that nutrition and access to food is something that impacts everyone, not just an individual. And outside of our meals, we also like to make sure that our clients feel really appreciated and loved. So we send personalized birthday cakes and cards signed by volunteers and staff every year for our clients' birthdays. And we also offer special holiday meals. So our biggest day of the year is Thanksgiving, and we provide 2 meals to all of our clients to make sure that they're able to enjoy the holiday with a loved one or a friend or a neighbor. And then we also offer a winter feast before the new year. Lastly, we know that inclement weather is something that happens in New York, so it's important that our clients have emergency meals, or some shelf-stable options if for some reason our delivery drivers aren't able to make it to their house. So we do that twice a year and provide them with some shelf-stable options. And before we finish off, it's important to talk about our eligibility criteria and how our referral process works. So to be eligible, you must reside within the 5 boroughs of New York City or Hudson County, New Jersey, and you must be living with a severe and/or chronic illness and also have difficulty shopping or cooking. Once a patient or a client has those things, we need to make sure they're accurate. So a medical provider will sign off and verify that the client has the specific illness and the impacted activities of daily living. So specific ICD codes for our sickle cell disease population are written on the screen. If anybody has any questions, I can send those over, or if you'd like a longer list of diagnoses, we can also send those over. But those specifically are the range of sickle cell disease codes that we accept. And we also like to make sure that our clients have the necessary resources to accept our meals. So they must have a refrigerator and freezer to safely store our meals. And this is really important because our meals do come frozen. So upon receiving the meals, they have to be placed into either the refrigerator or the freezer. We need to make sure our clients have an oven, a stove, or a microwave to reheat the meals. If for any reason a client doesn't have a refrigerator, a freezer, or a way of reheating the meals, we can work with community partners and hopefully acquire those resources to make sure that anybody who needs our meals is able to receive them. On delivery days, we ask that our clients are home between 8 a.m. and 4 p.m. Again, delivery will happen 1 to 2 days per week, and somebody needs to be there to receive the meals. Again, because they are frozen, it's really important to put them away as soon as possible and maintain the safety of the meals. Lastly, we ask that our clients have a working phone so we can contact them, because our team of registered dietitian nutritionists will talk to them on the phone, and it's important that our delivery drivers are able to get in contact with the clients as well. And what makes a complete referral? So really the medical form is the most important part of the referral, and that's what we talked about a few slides ago. So this is the form that verifies a client's diagnosis and their impaired activities of daily living. So the medical form has to be signed by a medical provider, again, somebody with prescriptive authority like an MD, a DO, an NP, or a PA. We also ask for a HIPAA confidentiality form and a client policies and procedures form. Forms can be submitted in any order, but really the medical form is the most important, and that's what's needed to start our services. And as far as making a referral goes, we do have a couple of pathways to filling out a referral. So our first is electronically using our Form Doctor platform. So again, I can send this out in an email to anybody who needs it, but this is just an electronic portal where you can enter a client's information and it'll send directly to us. We also have the option of downloading our referral packet online, filling it out manually, and then either mailing, emailing, or faxing it back to us. Some additional information that we might ask includes languages spoken, if there's a healthcare proxy, and then any recurring medical appointments, just to make sure that we're delivering when a client is home and when it works best for a client. And before we finish off, it's really important to talk about what we've accomplished since opening up sickle cell disease as one of our eligible diagnoses. So again, in late March of 2024, we added sickle cell disease to our eligible diagnoses list. And so it's just been about 6 months, and we've had 13 clients plus 3 of their caregivers, and over half of the clients we've served have been pediatric, so children, adolescents, but 61.5% of the clients we've served have been within the pediatric population. To these 13 clients and 3 caregivers, we've delivered almost 2,000 meals, And something we're really proud of is that 100% of our clients have stayed on the program since starting. So it's really important that we know our clients feel appreciated and supported and feel the positive impact of our medically tailored meals and of our nutrition counseling provided by our registered dietitian nutritionist. So we're really excited that this is an eligible diagnosis because the need is very much clear and present within our communities. And we know that medically tailored meals can be extremely beneficial for individuals with sickle cell disease. So thank you if anyone on the call has happened to refer anybody to our program, and we'll continue to serve individuals who really need our meals and need the support of medically tailored meals and nutrition counseling. So thank you to anybody who's referred anybody our way. And then just have some contact information, and that is it. So thank you so much, everybody.